Okay, so welcome to the key number third. So let's start from the key number third. This is called as diabetic ketoacidosis. So this occurs mostly in type 1 diabetes, okay, and because they don't have insulin, okay. So let me tell you briefly about the DKA. It occurs because of the uncontrolled lipolysis. So the body does not have the mechanism to push the glucose into the cell. Okay, so this is cell. This is done with the help of insulin. Okay, so they don't have insulin, so glucose cannot be tracked into the cell. What happens is that the body thinks that we don't have enough glucose. Okay, it does not think that I'm having some abnormality. It thinks that there is some problem and the patient might be fasting or something. Okay, he hasn't taken enough of the glucose. So in spite of the high glucose in your blood, your body goes into the uh, destruction of lipolysis. Okay, it does the lipolysis. It start the lipolysis. Okay, when it start lipolysis, it converts the lipids into fatty acid and glycerols. Fatty acids and glycerols. So there are three types of fatty acids. Those fatty acids gets accumulated in your body and they decrease the pH. Okay, and the patient will come to you and he will. So suppose the patient has come to you, he will present to you with abdominal pain. He will be vomiting. He might be having small breathing, which is called as deep hyperventilation. Okay, and there will be dehydration. Why? Because of the increased solute contents in his blood, and his glucose will be 11. Okay, his glucose will be 11. Our joint British Society uh, says that whenever a patient comes to you, you have to check his glucose level. If his glucose level is if his glucose level is more than 11 millimole per mole per liter, okay, and he is known diabetic mellitus, and his pH is more than 7.3, okay, and this is a diagnostic criteria, and his bicarb is less than 15 millimole per liter, okay. This is a diagnostic criteria by the Joint British Diabetes Society in order to diagnose a DKA, and his ketones will be more than 3 millimole per liter. Okay, or if you are doing dipstick, so there will be 2 plus on 2 plus of urine ketones on the urinalysis or dipstick. Okay, so now the patient has presented to you with all these symptoms. Okay, he is having severe problems. What you will do? You have to manage him quickly. Okay, so first thing is you have to give him IV fluids. Okay, because he is having severe dehydration because of the increased solute contents. So you have to give him 5 to 8 liters, and what you have to give him, you will give him 0.9 saline. Okay, normal saline. You can give him 0.9 sodium chloride. And in which patient are you giving to give him this? So remember, you have to give him 1 liter, 1 liter in first hour, and then 1 liter, 1 liter. So these 2 liter will be in next second hour, and then next second hour, and then 1 liter in 4 hour, and then 1 liter in next 4 hour. Okay, and then the last one is in next 16 hour. So you will give the gap in between them. So the first liter in first hour, the second liter after in the second hour, and the third liter will again be on in the second in 2 hours, in next 2 hours. Okay. Okay, so let me write here next so you will remember. This is the gap in between them. Okay, on the first liter on the in the first hour, then give to uh, in the next 2 hour you will give him second liter, and in again in the over next 2 hour you are going to give him, I mean give him slowly. Okay, or next give this liter in over next 2 hour, and then over next 2 hour, and then this liter over next 4 hour, and then this liter over next 4 hour, and then this 1 liter in next over the next 6 hour. So you remember 1 2 2 4 4 6, 1 2 2 4 4 6, and what are you going to give him? 0.9% normal saline. Okay, after that what you have to give him? Insulin. This insulin is given because of the two things. Okay, the one thing is most of your hyperglycemia will be treated by the normal saline. Okay, when you give him, his blood volume will be diluted, and much of the hyperglycemia will be decreased. But then again you have to give insulin. Why? Because insulin will try to uh, lower your blood sugar, and it will uh, drag the potassium into the cell, and it will because insulin will drag the glucose into the cell, so the body will stop producing or stop lipolysis. Okay, so there will be no further ketonuria. Okay, so it will also decrease the ketonuria, and you have to give insulin plus dextrose saline. Okay, they both are to be given consecutively. Okay, and when they are going to be given? Okay, let me tell you. Okay, so they are to be given when your blood glucose is less than 15 millimole per liter. Okay, then you can start the infusion of 5% dextrose. You can give 5% dextrose. Okay, and along with insulin and plus insulin, and insulin should be calculated. You can give 0.1 mg, sorry, 0.1 unit per kg. Okay, and per hour, 0.1 unit per kg per hour. Okay, this is the dose. So then you can start insulin with dextrose. What they will do is they will drag the first of all they will drag the glucose into the cell, that will inhibit the further lipolysis, and will further inhibit the production of ketonuria. It will drag the potassium into the cells. Okay, so there will be no toxicity of high potassium, and then you have to give him insulin, not because of not to lower further the glucose level. Okay, you have to give him insulin until there is no ketonuria in his urine dipstick. Okay, okay, so that is done. Note, okay, followed by IV infusion of insulin, measure arterial blood gases. And yes, arterial blood gases. Why? Because you were having ketonuria, and ketones were produced, or fatty acids were, which lowered the pH. Now you have to check whether your pH is increased or not. Okay, and then again pick measure capillary blood glucose, obviously. Okay, okay, and then diagnosis is when pH is less than 3, ketonemia more than 3, or ketonuria plus 2, or okay. So this is basically the joint British Society's diagnostic criteria, which I described here in first here. Okay, glucose more than 11, okay, millimole per liter, and pH will be more than 7.3, and bicarbonate will be less than 15, ketone will be more than 3 millimole, or 2 plus on urine dipstick. That is it. Thank you.